I am both honored and proud to be here today. Honored to be pinch hitting for my really good friend, Doug Embledge, who regrettably could not be here. Doug was the first reporter in this community, as Dr. Scharf knows, to shed light on the need for a facility like this one here today. He did so by very eloquently sharing that story with a brave young man who came forward to tell about the need. And professionally and personally, Doug understands this need, just like all of you here today. And I am proud to be from a community that not only recognizes this need, but acted on it. Kudos to all of you, and congratulations. Chief among them who saw that need and acted on it is the leader of the University of Rochester, the 111th president, Sarah Mangelsdorf. Mangelsdorf is an experienced academic leader who is internationally known for her research on social and emotional personal development and for her work on issues of academic quality, educational access, and diversity and inclusion. She also holds the title of the G. Robert Whitmer Jr. University Professor and is an elected member of the American Academy of Arts and Sciences. Since her appointment in 2019, President Mangelsdorf has focused on defining the University of Rochester as a global research university of the future. She has increased the university's investment in research and clinical enterprises, work with staff and community leaders to elevate the university's status as a great place to work and champion the institution's strength as one university. Please join me in welcoming President Sarah Mangelsdorf. Quick confession, I don't have my readers on. You are the 11th president, not the 111th president. Sorry about that. That's okay. Bring the readers next time.
That's funny. Our university is not that old, anyway, or else they were burning through presidents at about a year at a time. The last 5 years I've been president here, and I'd say being university president these days, it's tough, and nationally the terms are getting shorter, but not that short. So thank you, Ginny, for that introduction, and thanks to all of you for being here today. This is a really important moment for our community. And Ginny told you a little about my personal bio, and I am a developmental psychologist who studies emotional and personality development and developmental psychopathology, so what leads to children having emotional problems. So this project is near and dear to me. And for those of you who aren't aware, this is a very unusual facility we're celebrating. This is not present in every community. We're leaders in doing this. So before I get into the guts of all this, I really want to acknowledge the incredible generosity of the donors who've made this day possible, especially the Brighter Days Foundation, Mark and Maureen David, Jeff and Patty Davis, whose leadership as our honorary chairs for the 2022 gala helped raise over $2 million for the center, Don and Leslie Tomini, Art and Judy Finachario. I went around and asked them how to correctly pronounce all of their names. I'm working on it. Tim and Susan Fournier, and LaChase Construction, which slips easily off the tongue. My sincere thanks to everyone who supported this incredibly important project. I also want to acknowledge some of our elected officials that have joined us today. Please join me in welcoming County Executive Adam Bello, Mayor Malik Evans, New York State Senator Samar Brook, New York State Assemblyman Harry Bronson, New York State Assembly Member Jen Lensford, and New York State Assembly Member Sarah Clark. Thank you all for being here. Thank you for your support. And thank you for helping to champion these efforts to improve mental health access and care in our community. I'd like to give a special thanks to our change-making visionary medical leadership, Dr. Halterman, Dr. Lee, and Dr. Scharf. Your dedication created the pathway for this vital community resource, the Brighter Days Pediatric Mental Health Urgent Care Center, to become a reality. These investments are significantly and just a year ago, we broke ground on this much-needed facility, and today we gather to officially open this space, the Finger Lakes region's first mental health urgent care center for children and teens. I was saying to one of the folks I was talking to how important these kinds of facilities are, because otherwise children are just taken to adult psychiatric facilities. And having worked in inpatient adult psychiatric facilities in a previous phase of my life, I can tell they're rather frightening places. So if you were a child that was having emotional issues, if you didn't have emotional issues before you went into the adult psych unit, you would have them when you came out. So it's really good for us to look at how to treat mental health issues in young people in a developmentally appropriate and sensitive way. So without a doubt, it's a milestone day for our community. I hope you all saw the great news the week before last about another historic moment for our university when we announced the generous gift from Tom Golisano to build the Golisano Intellectual and Developmental Disabilities Institute. That was another great day for our university and for our community. These investments are significantly expanding and enhancing our ability to improve the quality of life for people in our region living with mental illness, behavioral health conditions, and intellectual and developmental disabilities. I'm proud to be here, to be part of a community and healthcare system that is focused on helping young people and supporting them during a crisis. Marian Wright Edelman, who used to head up the children's organization called the Children's Defense Fund, often pointed out, children don't have any lobbying groups. It's not like there's an AARP for kids, right? And so we really need to look out for them. It's very important that we think about the needs of our youngest and most vulnerable. The opening of this facility is part of Golisano Children's Hospital's ongoing efforts to better serve our community and our most vulnerable young people. Our Golisano Behavioral Health and Wellness Center on South Avenue, which opened in June of 2020, is another example of what we are doing to try to help children and teens on their path to wellness and a healthy adulthood. These programs and the facilities underscore our university's commitment to healthcare of the highest order, a fundamental aspect of our 2030 Boundless Possibilities Strategic Plan. These efforts will reinforce and enhance our position as a leading academic medical center, one that is really dedicated to serving the community. All that said, what we're doing today is monumental. This new center and the skilled, compassionate healthcare professionals within it will help the young people get the immediate care they need, support them during crisis, and offer them and their families much needed hope and healing. So thank you all for being here. I'd now like to invite Dr. Jill Halterman, Physician-in-Chief of Golisano Children's Hospital, to tell you more about the facility.
Good morning. Thank you, President Mangelsdorf. To fully understand the achievement that we're celebrating today, I want to take us back about a decade ago. It was then that Dr. Mike Scharf, Chief of Child and Adolescent Psychiatry, sounded the alarm that both nationally and right here in Rochester, there was a dire need to expand children's mental health services. There were increases in diagnoses of mental health disorders, emergency psychiatric visits, and a demand for outpatient services that we weren't able to meet. And behind these alarming statistics were real children and families struggling to face the challenges associated with mental illness. Challenges that not only impact the child, but ripple through families and communities, often with devastating effects. Finding timely mental health care has been an additional burden, requiring families to navigate a complex system at a time that they're most vulnerable. Dr. Scharf and his team had a vision to proactively address this need, and to do so in a way that equitably removes care barriers. During the past 5 years, we've seen the culmination of this vision. First, with the opening of the Golisano Behavioral Health and Wellness Center in 2020, combined with the co-creation of new programs to deliver mental health screening and care right in schools where children spend much of their day. And now, the opening of the Brighter Days Pediatric Mental Health Urgent Care Center to provide the very first walk-in service in upstate New York. Brighter Days represents an incredible opportunity to build on the progress we've made in addressing pediatric mental health. We've succeeded as a community in treating more children before they get to the point of needing emergency care. This accomplishment is a testament to what we can achieve when we come together with a shared vision and determination to make a difference in our community. It's a promise to children that their mental health matters, that their struggles are seen and heard, and that they are not alone. These milestones could not be achieved without the contribution of our incredible donors. Today, we extend our deepest appreciation to Kathy and Frank York and many others. Kathy and Frank are representatives of the Brighter Days Foundation, and they've had the passion and the commitment to ensure that children in our region get immediate access to mental health care when they need it the most. Thank you so much for your commitment to helping all children reach their full potential. And with that, I'd like to introduce Kathy and Frank York.
Okay, I'll be very brief. First, Kathy and I would like to thank all of you for joining us here today at the opening of this Pediatric Mental Health and Wellness Center. This is really, as you've heard from our previous speakers, this is a really important day for the Rochester community. And we've all seen, and I won't go on, we've got far better experts than I to talk about it, but we've all seen or are aware of the significant increase in mental health crises amongst young people that was there already because of social media, and it got even worse because of the pandemic. You either know somebody, perhaps it's someone in your own family, or you know somebody who has it happening in their family. We're all very aware of it. So we kind of got together with some other folks and said it's time to take action. And this community partnership came together and has done so. And so we're proud, very proud to have been a part of this. Proud to have joined with the U of R Medical Center and a number of families and community members, most of whom are here, to make this urgent care happen. And I must say, I'll go off speech here a little bit and say, I want to say congratulations to everyone from the University of Rochester and the Medical Center that have been involved with this, because you knocked it out of the ballpark. You really did. How often does something like this get done in a year and a half? Just doesn't happen. So well done. So now my challenge is let's get after it. Let's make this facility a shining example by all of our continuing support and by the good work of the professional staff here that brighter days are indeed ahead for our young people and their families. I appreciate everyone being here. Thank you very much.
Now we'd like to invite Scott Beeler to come up. He is the president and CEO of Western Automotive Group.
Good morning. We have a small part to play here in this fantastic day for Rochester to see this beautiful center being opening today. But Western's proud to play this small part in it. Western now has been in Rochester for 14 years. We now have 11 dealerships and we employ 1,000 people, so Rochester's become a very important part of our company, and we're proud to, in a small way, give back today and let you know we appreciate the support you've given our company. Safe, prompt, supervised transportation is a critical component to the services that will be provided here. With a dedicated vehicle and trained staff, the team will be able to transport pediatric patients in need of immediate mental care health and their parents in a family-centered, trauma-informed manner. I want to thank Kathy York, who brought this opportunity to us a while ago. It's been a pleasure to work with you, and glad we have this outcome. So at this point, West Her is pleased to present this van to the Brighter Days Care Center at Golisano Children's Hospital. So if I can invite Dr. Scharf to come up, I'll be handing him the keys.
Thank you.
And you'll notice we're giving 3 sets. Who gets 3 sets of keys? So,
Thank you. Thank you. Some of you already know this, but I'm so excited about today, the center, and this gift that one of the sets of keys is for me. I actually got credentialed to be a driver. That's actually true. I am so proud and honored and in many ways humbled to be here today. I mean, look at the turnout. If you haven't looked around, just take a second and look around at how many people have shown up today. I thank you to all of you. This is really such an outstanding, in the moment, real time, while life continues to go on, show of support. We try to keep these things tight. I've been asked not to repeat things others were saying, but I have to repeat thanks to Frank and Kathy York for the Brighter Days Foundation and for everything they've done. Please join me in thanking them. And you know, obviously, the center bears their name, the foundation name, Brighter Days. But as you already heard, Kathy and Frank, and Kathy in particular, has really been a force behind the scenes, sort of filling in the gaps, making sure that we would be really ready to not only open doors, but really meet families in a flexible, family-centered way, for many of them at the worst point in their lives. I'm very thankful for that. And as one example, well, you saw one example with the facilitation of our relationship with West Her. Scott, thank you so much, and Rhonda, who helped make that happen as well, thank you. Another thing that Kathy has done is really help mobilize additional donors, not only for this project, but to help open today the Ronald McDonald House Charities Wellness Lounge, which is now the Patrick Brophy Wellness Lounge, located right adjacent to the entrance here. I'm very thankful for them. I'm thankful for our partners with Ronald McDonald House. Joanne, thank you so much for your dedication to this project. And I mentioned Dr. Brophy. Most of us here, I believe, have known Dr. Brophy, had touched our lives in some way, even if it was only as a leader in the places we work. He's a close friend of mine, very impactful on all of the things we've been able to do today. And I'm delighted that he can have a presence in this project going forward. I miss him. I wish he was here today. There's a number of other people who couldn't be here today. Thank you for joining us on the live stream. It is, again, really a marker of just how our community is responding. A couple more people I want to thank. They've been mentioned, but I need to thank again Mark and Maureen Davitt. Your dedication, support for children mental health generally and for this project is just so impressive. Thank you so much. Don and Leslie Tomini. Don has been my coach to talk less and be brief, which might be the most important contribution he's made to children's mental health. But the gift of their financial resources and support, and again, making connections, has been really critical. Thank you to the Tominis. I'm looking for people to help me remember. I don't see where Art is. All the way down. Okay. Art and Judy Funicerio, I want to thank you guys. Again, just consistent over time presence and support for our services, and what you see outside here would not have happened if it wasn't for Art and for the next two folks that I mentioned. Tim and Susan Fournier, you're over here also. There we go. All right. I want to recognize them. Again, so thankful for their support. And then Jeff and Patty Davis. Jeff and Patty
have become really close friends and partners in this process, and I'm so thankful for what they've done. For those of you who were involved in the gala in 2022, that was an unprecedented focus on children's mental health for the Children's Hospital, but also an unprecedented outcome in terms of the money we raised, the financial support. So again, I really, really want to thank all of our donors. Another prominent donor you've already heard mentioned, LaChase Construction. So thank you, thank you. This center is about helping children, helping families in times of crisis. There's a couple different ways that I've described, and you could look at this. One is to fill the gaps, to provide flexible, truly family-centered alternatives to emergency options that exist right now. You already heard reference from President Mangelsdorf to what adult facilities are like. And you know, the reality is people who work in our adult facilities of all types, and in particular, I think our attention is drawn to what happens in our CPAP or our Psych-ED. These Psych-EDs are designed based on a worst-case scenario to provide enough staff and support to really help people survive the worst-case scenario. It can be life-saving. It's critically important. But it's not really a good fit for the majority of children in crisis. In fact, based on chart reviews and talking with families, about 80% of the kids that come through CPAP could get their needs met with an alternative. Doesn't need the same level of security, intensity, and the same environment. And that's what the Brighter Days Pediatric Mental Health Urgent Care is primarily here to do, is to provide that alternative. I'm delighted to be here. I'm delighted to be able to kick this off. I've thanked some of our financial donors, but I think it's also really important to recognize that this is a community problem. When we think about children's mental health needs, what's been articulated as a pediatric mental health crisis, that term was first coined in 2015, and things have continued to get worse, as Frank mentioned, with the pandemic, another at a society level blow to the health and well-being of children. As we look at what's happened over time, many of the markers of this mental health crisis have continued to get worse and continue to this day. Professional societies, government agencies have declared states of emergency about children's mental health. I'm proud to say that we're in a community that has started to turn the corner. Already, if we just look at the number of children that present to our CPAP, after recovering from the initial phase of the pandemic, we've returned to 2019 levels, and we've peaked there. Now, I am saying that we should all be proud of maintaining the horrible, inadequate state we were in. But again, if you look around compared to the rest of the country, the rest of the continent, we really should be proud of that. And it's because of the things we've already done. It's because of generous contributions to make facilities like this possible, to make service expansions possible, but some of the things that might not be as obvious. When we have a really strong support, and I'm proud to work at the University of Rochester, our leadership has financially matched our biggest donations and contributions in order to ensure the success of these projects. That might feel, yeah, thank you. It might feel like behind the scenes inside baseball stuff, but it is not what happens in every facility, in every institution, and it really does make a difference. We also have a community of dedicated people that have stepped up to help design the plan. If we didn't have parent voice and community voice to help us, we would be stuck in the worst case scenario in the CPAP. It requires taking a step back and truly listening and collaborating on our part. But it also requires bravery, confidence, and an ability to advocate for self and for your family to tell us what we should be doing better and help us get it right. I am so thankful for our parent advisory group, for the numbers of people who have talked to me directly and helped create the plan. And this is not only a thank you, it's an invitation. I think we've done a lot of things right. We're trying to fill a lot of gaps. We're trying to do a lot of creative things based on real needs. We've identified real families we've talked to, and I'm sure there's things that we will have missed or not got exactly right. And so it's critical we continue that conversation. And I want people to contact me directly about things we can do to continue to improve. We also have so many people in our community that are dedicated to doing the work to help children and families. We have a number of medical providers here, primary care providers in the audience. I don't know if anyone wants to hoot or acknowledge that they're here, but I want to thank all of our primary care providers. I had the pleasure of running into at least half a dozen teachers just walking from there to here, and I'm sure there's more teachers and school professionals here that have shown up, and I am so thankful for you. We also have, not to cast aspersions, this is really just pride. I think we have the best nurses in the community working for us in child psychiatry, and I want to thank our nurses. Again, I am honored to lead this team and to have the relationships I have and to be able to witness the care that's provided. We have nurses here, and not just nurses, but our psych techs, our other staff that are helping make the care possible and happen, our youth outreach workers, care managers. I want to give everyone recognition for the work that you're doing. It's a community challenge. We're creating a community solution. And I already mentioned the importance of patient and parent voice. We're very fortunate to have had some spokesmen, some spokespeople come forward who were teens at the time we met and had the conversations. Some are adults now, to really help draw attention, to tell their stories. I think it's probably fair to say in 2024, it's not as big of a deal as in 2014 to go public, if you will, and talk about mental health challenges. But stigma is still real. The challenges of admitting, acknowledging challenges you face, adversity you faced, it's a big deal. And I want to recognize everyone who's come forward and spoken about their own experience. And in particular, I want to recognize a few people. Is Jake here? I see Jake's dad. Jake couldn't make it today? Well, I see Jake's dad. Dave O'May is here. Dave, I don't know if you want to stand or wave. When Ginny started and was talking about Doug Embledge's first story and interviewing youth, that was Jake. Jake had actually taken an adverse experience, not only what he was suffering with, but frankly in his care, and particularly the emergency phase of his care, taken an adverse experience and tried to move it to positive action by reaching out to media and leadership to try to affect change. I'm very thankful for Jake and for Dave, and they've continued to be strong supports. And in fact, Dave emailed me last night. I just read it this morning, and he shared something that I just thought was powerful. He said, imagine yourself at the worst point in your life, the darkest, saddest period of time feelings, and taking a minute to sit with that feeling. Now imagine doing that 4,200 times. That's the number of minutes Jake waited in the CPEP to get moved on to an actual place to sleep and a facility where he could actually get the care he needed. Again, I want to thank Jake. I want to thank Dave for being here today. Thank you. Jake is no longer a teen or a child. He's now an adult and working, and I'm very pleased to continue to have interactions and track his progress. We have Lauren O'Pladen here today. Lauren has been such a wonderful spokesperson. Lauren was here at our groundbreaking and we've had the fortune of working with her as a spokesperson, her and her mom Janice, who couldn't be here today, for a variety of efforts, including the opening of that building in 2020, the kickoff of this project. And Lauren is now a nurse here working at U of R in the ICU. We're so pleased and happy that she's here today. And we have one more person here today representing the patient experience. This is a young man who I actually had met doing clinical work. I do, in addition to standing in front of rooms, I do still do clinical work. And I had the opportunity to meet him, again, in an emergency crisis situation like the situations we're talking about. But where I really started to get to know him more is a few months later, I received a letter written in crayon from a 13-year-old who had been in our hospital for a long time, had faced a number of challenges, which I'm going to let him describe in more detail. But the reason he wrote a letter wasn't to complain, wasn't to, to even ask for things for himself, but it was to talk about what he had witnessed with staff and to advocate for more support and better treatment for our staff that work in our mental health facilities. It really touched my heart and continues to. And I'm just so proud of how he's done since then and the point he's at, and that he can join me up at the podium right now to talk a little more. Blaine Hayward Collins.
Blaine, thank you. I'd like to admit that there were no other utensils. I'd like to start off by thanking everyone for coming out here today, taking time out of your day to listen to my story. Some of you might know me from the time I spent in 49000 Pediatric Mental Unit, where kids like myself have learned to have some faith and believe that they have a purpose in their lives. Some of you might not know me at all. Having said that, I'd like to introduce myself. My name is Blaine Hayward Collins. I'm a 14-year-old boy who likes basketball, playing guitar, singing, riding bikes, but most of all, I always just wanted a complete family. When I was 4 years old, my life changed a lot. My mother went to prison. I didn't know my father's side of the family. And my mom's side of the family was either deceased or in prison as well. Excuse me. So I went with my father's side of the family, and it was actually great until my dad had to go away as well, leaving me only to my grandparents. I still to this day have emotional trauma that I didn't even know about, working on that today and every day since. And after all that, I did try to take my life. I knew my life wasn't perfect, but I knew it could have been worse. I did end up in the ICU for about 2 to 3 weeks and proceeded to go to 49000, which was a delightful place, excuse me, for about 7 to 8 months. The only reason why I really made it through is because of this amazing staff on that floor, who today I still consider my family. A person I was very close to gave me a considerate quote that still helps me to this day. Family isn't the ones you share blood with. Family's the ones that you let in your circle of trust. And I will say that 99% of strong staff are in my circle. To give more insight about the new urgent care, I'd like to compare it to CPEP. For instance, CPEP is a worst-case scenario unit. It could be critical for some, but not all. It is a one-size-fits-all, and not all youth quite need that. But now, with the opening of the new urgent care, I look forward to seeing more individualized, more comfortable, more flexible, hopefully more beds, and more independently set to individual needs. Just like in all mental health services, I'm going to 100% guarantee that your children, patients, family, or friends that go to this urgent care will be shown love, faith, and care. Thank you for listening. Have a great day.
Blaine, you are an exceptional spokesperson. And and thank you for your advocacy, crayons and all. Well, when you got a big deal like this, we got a big ribbon, and we have a lot of hands that we want involved in this because so many people played a part in this. So I'd like to invite the following people up to take part in the ribbon cupping. Starting with President Mangelsdorf. I'm going to ask you to go to the center right. We've got some folks over there to help you. Dr. Scharf, you're a gem for our community, a true treasure. Dr. Kathy Perinello, and may I say for the first time I understand I'm saying your new title, President and CEO of Strong Hospital. And Dr. Jill Halterman, thank you for your leadership. Also lining up to the right are our important donors, Frank and Kathy York. Thank you very much for your leadership. Jeff and Patty Davis, Judy and Art Finichario, Tim and Susan Fournier and Scott Beeler. And our incredible advocates, Lauren Uplayden. Lauren. Blaine Hayward Collins. Oh man, you got a fan club here. And Dr. Linda Alpert Gillis. And lining up to the left, if I may ask, other important donors, folks that made this happen, Mark and Maureen Davitt. Thank you so much. Don and Leslie Tomini. And Bill Goodrich, representing LaChase Construction. Thank you. And now our elected leaders, so we're so graced with their presence today. Monroe County Executive Adam Bello, thank you. April Aycock, Director of Mental Health for Monroe County. Mayor Malik Evans. New York Assemblymember Harry Bronson. New York Assemblyman Jen Lunsford. New York Assemblymember Sarah Clark. And State Senator Samara Brook. All right, are we ready? A few more scissors to get in hands here. All right, we are ready to cut the ribbon at our new Mental Health and Wellness Center, a historic day in Rochester on 3, 2, 1.